Alright, so when you're assessing the active range of motion and passive range of motion with overpressure of your patients, you're going to want to start with active range of motion in all directions before you start applying overpressure. So what I'm going to ask Andrew to do is cross his arms over his chest and then bend forward as far as he can. And I'm going to ask him if he has any discomfort or reproduction of his symptoms. And then I'll have him come back up to the neutral position. And I'm going to ask him to bend to one side for me as far as he can. Again, monitoring for any symptoms or reproduction of his pain. I'm going to place my hand right about at the LT junction, and I'm going to have him try and extend back over that. You can kind of guide them a little bit in case they're anxious, and then kind of bring them back up. Again, checking to see if that reproduces symptoms, and having them side bend this way, and then back, and then we'll go into rotation, and then the other direction. We're looking for reasonably symmetrical motion within normal limits. To apply overpressure, I'm going to kind of start in the same order as before. I'm going to ask him to flex forward, and I'm providing some compression over his shoulders and about with the LT junction, and I'm trying to squeeze my hands together and see if that reproduces any of his symptoms. And then I'll bring him back up, and then I'm going to ask him to side bend. I'm standing on his opposite side so I can provide compression through his opposite shoulder while maintaining pretty good body mechanics so it's not bothering me. So we're going to bring him over to the side and compress through his shoulder, holding for a few seconds to see if he gets any latent response to that. Then we bring him back up to neutral. I'm going to put my hand again at the LT junction. I'm going to get a little closer, and I'm going to help him extend over that hand. Hold him there for a few seconds, and then bring him back up. And side bending, I would move around to the opposite side and side bend that way, but I'll just make it a little shorter, and we're going to go right into rotation. I'm going to hold his shoulders and just give him a little bit of pressure towards me and counter pressure away on the opposite side, and then back this way towards me, and same thing, looking for reproduction of symptoms.